that Medicaid patients are 13% more likely to die than those without insurance of any kind in a surgical procedure. They evaluated just a hair under 900,000 major surgical operations. They didn't exactly talk to 5 guys on the street. They went and looked at 900,000, close to 900,000 cases. Patients on Medicare were 45% more likely to die than those with private insurance. Uninsured were 74% more likely. Medicaid patients, 93% more likely. There's no evidence whatsoever that Medicaid improves overall health outcomes. Yes? Next slide. What it does, though, is that if you're somewhat poor, on the edge, and the government will suddenly cover you, well, you drop your health insurance. Duh. Employers don't contribute, they're paying higher taxes. Employees are less likely to join or get into a plan that their employer provides or an individual plan. And of course, it increases prices because the cost of Medicaid is borne not just by the patients, not just by the taxpayers, but by the doctors and the other patients who that doctor is seeing. Next slide. And this is the really cool part. This is showing the low-wage trap. This is how a single mother of 2 is earning real good $10,000, but based on all the various welfare programs, including Medicaid, she's making $40,000 in real terms. And she can go all the way up to making $50,000 of real money, but she's still only making about what she would make before, because as she gets more, if you start off at Walmart as a cashier and then you work your way up to a manager, your salary may go from $20,000 to $50,000. You may be working 50, 60 hours a week, doing all these things to improve yourself, getting an education, but you're still stuck with the same darn salary. That is largely attributable to programs like Medicaid, but not limited to it. Next slide. So, this is the big question. This is what Newt Gingrich completely flubbed in the presidential debates. I'll tell you in less than 2 minutes how, if I were, say, president or in charge of something in Washington, I would reform our healthcare system. First, equalized tax treatment of healthcare. The original sin of American healthcare happened during World War II when we started driving people into employer-sponsored care because we gave employers, not individuals, a tax benefit. Either give individuals the same tax benefits as your employers get, or take it away from everybody. McCain talked about this, but got pilloried by Obama, the tax hiker, for being a tax hiker, although his plan would have actually turned healthcare into more of a marketplace. Block grant Medicare and Medicaid to the states. It worked for welfare, it keeps working, and if we did it for those 2 programs, it would work again. The states are way more creative than Washington. Washington has not done anything correctly in, as far as I can see, decades. So I would much rather see the states, and maybe the states will screw it up, but eventually they'll catch on to the states that are doing things right. And lastly, allow for insurance to be purchased across state lines. New Mexico has 59 mandates, everything from alcoholism for people who don't drink to people who want in vitro fertilization and all kinds of other expensive procedures that have been foisted on us by our friends in Santa Fe. So Arizona, right next door, has 35 mandates. There's a bunch fewer. States like Idaho, I think, has like 17 or 20 mandates. So we could buy insurance plans sold out of Arizona, not have all the mandates, and have much cheaper insurance. Next slide. This is, again, a complicated slide. I was hoping to be sitting right here or something, but Florida and other states have reformed Medicaid within the scope of where they can do it. Rather than having this crappy one-size-fits-all government-controlled system, they've gotten waivers. Believe it or not, that Obama has given some states waivers. And so they enroll them in much more like a private insurance mechanism. We're actually encouraged to stay healthy, you work on wellness, losing weight, stopping smoking, getting off drugs, all those kinds of wonderful things. That Medicaid, they don't really give a rat's you know what if you do any of that stuff. So what they've done in Florida is made health care for low-income people actually work for them. They've cut costs about 10%, and it's really working out well for them in Florida. New Mexico could and should ask for a waiver on Medicaid to do some of these things as well. Next slide. And so if I have any time left, I'm happy to answer any thoughts or questions. My expertise is obviously at the state level, and that's partially because I'm pretty distraught about what I see in Washington. And I'm not sure that I don't think anyone has the cojones to do what needs to be done to actually reform the healthcare system. Certainly, the folks that have been put forth as public officials outside of a handful of Tea Party candidates, I might add, from the Senate and U.S. House. Very few other folks are really even talking about serious healthcare reform. So you guys can give me the hook anytime though, but I'll take one question right here before Rick gets over here and tackles me.
I just have a question as to your thoughts about tort reform and the importance of that.
Tort reform. Now, there are some things that I may say may deviate from the zeitgeist of the moment. I will say that tort reform is a potential at the state level. New Mexico's got a decent reform of torts. I'm a constitutionalist, and I don't believe that Washington should usurp the one-size-fits-all tort reform and say, here's a cap for everybody. You know, a cap in California is going to be a lot different than a cap in New Mexico. So the individual states have and have been experimenting, some very successfully like Texas, with this. New Mexico has done tort reform and has kind of backslid a little bit over the years. But I don't think it's the be-all, end-all answer, period. There's no silver bullet in healthcare. You need to do a lot of things. The best thing that we can do is to restore individual decisions over our healthcare expenditures. That's the only way to cut costs and improve quality at the same time. It's a proven fact in all areas of life. And that's really